Never let the things you cannot do prevent you from doing the things you can. Good evening. This is Facts of Health. I'm Na Edu. Thank you so much for joining us today. Today we are discussing thyroid disease, and I'm with Nana Adwoa Konadu Dsane. She is the president and founder of the Thyroid Foundation Ghana. Thank you for staying with us. Follow us on all social media handles: Facebook, Facts of Health; Instagram, facts.of.health; Twitter @FactsOfHealth1, and subscribe to the YouTube channel Facts of Health. Send your messages through 0204391417, 0204391417. Stay tuned. We'll be right back. You can send your messages through 0204391417, 0204391417. We'll open phone lines later on. You get to join the show. Today we are discussing thyroid disease, and I'm with Nana Adwoa Konadu Dsane. She is the founder and president, Thyroid Ghana Foundation. Nana,
why is sweet?
Oh, thank you. I'm a meet your mom that you are looking exquisite.
Thank you.
It's always good to have you on the show, don't you see that?
Yeah.
It's like a year.
What's that?
Now I may try 6 months. Yeah. Thank you so much for coming. It's Thyroid Awareness Week, right? So before we go into what thyroid is, I know you've done a lot of plans for the awareness and all that. If you can send us through the plans for the week and what's the role the media is playing, and how far you've gone with education, actually, with thyroid.
All right. So with the Thyroid Awareness Week, it's from 25th May to 31st May. That is the World Thyroid Awareness Week. So on the 25th of May, we are launching this year's Thyroid Awareness Week at the University of Ghana Medical Center. And we are doing a collaborative subsidized thyroid surgeries with the University of Ghana Medical Center since last year, yes. So this year too, we are continuing. We are launching the phase 2 of the surgery. So far, we've done 17 surgeries.
Wow! From
last year that
Beautiful.
I came here, and they gave us a slot for 20. The other 3 people are on medication when their levels are normalized now. Yeah, almost surgery now. So that is the 25th is on Wednesday. Wednesday 9 a.m. we are launching the second phase. Then through that, we are going to have a discussion on, is it important to screen our babies for thyroid disease? Because some babies come with thyroid disorders.
Really?
Yes.
Okay.
We don't really, our mind doesn't go there. It's done outside Ghana. Other countries do screen babies. It's part of the screening. It has to be part. Because some babies come with congenital hypothyroidism that their thyroid function is not that up to. So if such things are not detected, that the baby will have a lot of complications, growth, brain development, and all that. Until on the 25th, no, we are launching. We are going to have a pediatrician taking us through the importance of screening our babies for congenital hypothyroidism. Then we'll also have a surgeon, the surgeon who has done the 17 surgeries successfully.
Wow.
Dr. Brookman will also take us through the facts and myths of thyroid surgeries. You know, a lot of people think that when you do it,
so far as you are going to come my neck,
you know,
yeah,
that kind of
so far as you are going to come my neck, it's a no.
So the myths and the facts, we also hear about that one. It will be a hybrid in person. We'll do Facebook Live, and then we are also planning to have a Zoom link as well, which we'll put down. So, and then on the Saturday, we are going to have Frank, our dietitian, the onco-dietitian.
The onco-dietitian, the whole. I've missed him though.
Oh yeah, I know you've missed him. So when I told him I was coming here, he said I should say hi. So we are going to have Frank take our patient through dietary choices after thyroid surgeries, because we are launching the second phase. So after you have your thyroid surgery, what are the dietary choices? So we also have another dietitian with him who will take us through demonstration. So we'll do food demonstration. So call it
then I'll come and eat.
You have to come.
I'll come and eat.
So it will be a talk and the food bazaar. That one we'll do it at Konadu.
Oh, that's so close to me.
Very close to you. So close, yes. So it will be at 1 p.m. on Saturday. Then on the Sunday, we are going to donate to a children's home in Edakuman.
Wow.
So if you have any used clothing but not touched it, you can donate to us and we'll also send to them, because we visited them and they put that the clothes the children are wearing, they don't have it. So we are collecting clothes from people to go and donate to them, and we'll add food stuff as well.
I like your plan. The week is packed.
It's packed. It's fully packed. Then on Monday, we'll have another session, which we are going to have a media engagement. We are going to talk about, we are also doing another collaboration with UGMC, but the research.
Okay.
We are trying to launch a research into congenital thyroid in babies. So we are going to have babies, we'll screen them and see, so that we can have facts to back the research. So we are going to do that one, and we are going to launch that one on the Monday. Then finally, the 31st, we are going to have Dr. Beidu, the ENT surgeon, also at Konadu, taking us through the role ENT play in thyroid care. Because mostly when some of the thyroid patients, when they are referred to go and see the ENT surgeons, some of them will call you and say, why are they asking me to go and see ENT surgeon? I don't understand. So we want them to understand that ENT is part of thyroid care.
Is it because it's in your throat?
Exactly. They also have a role to play, because when you are going to do the surgery, the ENT surgeon will have to go into your throat to see that is this safe for you? Is it not attacking any of your cord, your vocal cord, the nerves there? Is any nerve collapse and all that? They have to certify all those things before the surgeon can do the surgery. But mostly when they refer patients, they feel like it's waste of money. So we want the ENT surgeon to take us through. That one too will be a hybrid. We'll do a Zoom, we'll do Facebook Live, and then we'll do in person. That one too we'll do it at Konadu.
Wow, packed.
Yes,
I would have to be part of the activity.
You have to. It's very important.
It's very important.
Yes.
You've taken us through the week, the awareness week, and I know people are out there asking, what is thyroid? So if you can take us through what thyroid is. Then I've heard you mention congenital thyroid, then you can take us through that.
Okay, so the thyroid is a gland. It's a thyroid gland. It's a gland below our Adam's apple. It's a butterfly shape designed. So it's like that. It has two loops, like how the butterfly is like, and then it's joined in the middle. So what it does is it produces a hormone or a fluid or water. Let me bring it down to everybody.
Yes.
So it produces some water, which is very important for the body system. So even if for the food that we eat, if the food would break down, and I say if it will grind to work well in your body. It depends on that water that the thyroid gland produces.
Oh, okay.
Yes. If you have a baby, if the baby's brain will be developed well, it depends on how the thyroid gland, the hormone that is producing or the water is producing, how efficient it is or how optimum it is to be able to have a baby developed well. So that's why I mentioned the congenital hypothyroidism.
Yeah.
Some babies are born and their thyroid gland is not really working well. Maybe it's not producing enough of the hormone.
Okay.
If you have a baby like that and the baby, we don't detect it early, the brain development of the baby will be impaired or it will affect the brain development. Even in some babies, it affects their physical growth.
Okay.
So even how for them to wear, for them to walk, for them to grow properly. Because sometimes you see some babies and
you're looking at the age, you're looking at the child,
looking at the child, you feel like no, the age doesn't match. So such babies has to be screened. Maybe their thyroid gland is not producing enough of the hormone or enough of the water that I'm talking about.
She used maybe.
Yes, maybe. It's not producing enough of the hormone or enough of that water. And that is what is impairing the growth of that baby. So if you screen the baby and it's not producing, then we can put the baby on the appropriate medication, appropriate diet support and all that, because thyroid and in babies comes with a whole package. Aside the medication, the baby had to be given the right food supplement, the right food itself to help with the growth. Yes.
I'm wondering how a baby is going to handle it, because you
even
and adults,
it's not an easy.
It's not an easy.
Not at all. So it's very important when we detect it early. That's why on the awareness week we are launching the fact that it's very important to screen our babies from day one. You know, mostly when we have our babies within the first 2 weeks, they do a whole lot of things for them. But the screening is not part. Out there in the US, when you have a baby, the first day they come and take a sample on the baby's foot and go and screen for hypothyroidism, because it can affect the baby in so many ways. Even your eyes, seeing the eyes, the brain to work well and all that are all can affect in that way.
I'm sure some will be home and they'll say, if I have a cerebral palsy child, then it might be that one.
Because some people may think that, yes.
So don't sit at home and
diagnose it.
Diagnose it, please.
You can go and ask a pediatrician or somebody to ask, oh, I heard that there's a thyroid that can also give similar symptoms. Can you check if maybe that is what the baby is also having? Maybe it could be, maybe it could not.
As research gone to the extent that you know whether pregnant women do something before they give birth to babies like that, or is something that they inherited, or it just happens?
You know, some of the thyroid diseases are autoimmune. Like what I had, the hypothyroid, most of the hypothyroid are autoimmune. Some of the hypo too are autoimmune. So those of us who have the autoimmune ones, most of the autoimmune ones are genetic. It's in the family. So if it's in the family, the probability that any baby, it may not be directly the person who has been detected that she has, but it could be any relative's baby having that. Once it's in the family, it can spring out anywhere. Exactly. So that's what we have to bear in mind, that if maybe it's in my family, I think that if I have a baby and that's the thing, yes, we have to check. But in Africa, we've not done so much research. When you search for research out there, most of it that has been done on surgeries. Like when they remove the surgery, what was found, where there's some cancer cells in what they removed and all that. Most of them had been in that way. But we've not done a lot of research in babies.
And what happens to them. Are there types? I've heard you mention hyper.
Yes, there are two main types of the disease aside the thyroid cancers.
Okay, so there are
thyroid cancers. Some people, by the time they see they have the thyroid disease, it's become cancerous.
Okay.
Others too, we have the two other main types, which we call the hypothyroidism. That is the thyroid gland, the hormone or the water that is producing, is not producing enough for your body to use to work well.
Wait, I'm not cutting it short. The thyroid cancer and thyroid disease is different from throat cancer of the throat.
It's different.
It's different.
Okay. This one, the thyroid cancer, is when the cancer affects, cancer cells come into the thyroid gland.
Okay.
With the throat cancer, it can be anywhere in the throat. but this one is specifically to the thyroid gland.
Okay.
Exactly. So aside those who have the thyroid cancers, where there are cancer cells in the thyroid gland, we also have those that the thyroid gland is not producing enough of the hormone, which we call the hypothyroidism. Like we have hypotension. That means it's below. Exactly. So it's below the normal level. And in that one, we have other types. We have about 4 different types within the hypo, but in general, we say that is not producing enough of the hormone. You're able to detect that it's particular one of this hypothyroidism after you do other scans. You have to do what we call the iodized scan of the thyroid gland to be able to know the type of the hypo that somebody has. Then we have those of us who have the hyper. It means that the thyroid gland is overproducing the water, and it's one is overproducing, it becomes a poison in your body, and it can affect you in so many ways.
If it's overproducing,
yes, it has to produce to the same balance. It shouldn't, like, it's like when you're fetching water in the tap. If it's the bucket is full, you see the whole place can get flooded. So when you are producing too much, your body will be flooded with the hormone, so it will affect you. If the water is also not enough, you will not get enough water to do what you have to do. So the body will also not get enough of the hormone to do what it has to do. So the two are the issues. But when you take the hyper, the overproducing, we have one we call Graves' disease. That is the one I had. That is the extreme of the overproducing.
Okay, the extreme
is Graves' disease. Yes.
Okay. Graves' disease.
Yes. That one, mostly the symptoms looks like it presents itself like a lot of diseases. So you lose your hair, and sometimes they will think that maybe you have cancer. Some of the people, you see that their eyes are protruding. Then some people, you lose weight. Some people, their menstrual cycle changes.
They just tag you with any
exactly, and they may treat the symptoms. You'll be having palpitations, your heart will be racing. Some people, their BP goes high, so they may treat you.
They'll give you,
exactly. So that one, it's a bit difficult. And then we have the inflammation ones.
So with that one, it doesn't
show. Most of it doesn't show. Some show, but most of it, about 75% research have shown that if you have a Graves' disease, the thyroid gland doesn't become big.
Okay, let me bring it down to it. So usually people see people's necks,
the goiter.
The goiter. That is what we used to call that. We didn't know there was thyroid in there. So we didn't baby. So we used to call it goiter. Yes. So that's what she's explaining. If you want to really understand what she's trying to mean, that is what she's really explaining. All right. So
with the goiters are, it can fall under hypo and hyper. Some people, they will have the hyper, but they may have the thyroid nodules. That is, there will be some boils inside the thyroid gland, and then the boil will be becoming big. Like you see, when somebody has a boil, we realize that it's becoming big. Yes, they are called nodules. So the nodules can come into the thyroid gland, and it will start becoming big.
Noodles, spaghetti.
They're noodles. Yes, spaghetti. So they are called noodles. So that one, it will be becoming bigger and bigger and bigger, and that is what we can see the goiter. So it can be somebody with the hyper. That person, sometimes their levels are high, or the hypo. Most goiters, they have the hypo.
Okay, levels are low.
Some too have, their levels are normal. They only have the goiter. Only the nodules are in the gland, in the nexus.
So whether normal or abnormal, or you need to check. Exactly. Let me hold on to that and take a quick commercial break. We'll be right back. So I'm with Adwoa Jani. We are discussing thyroid disease. She has taken us through the awareness week from 25th to 31st of May. She has taken us through the programs. I'm sure before we end the show, she would run through the programs again so that all those who would like to join and then visit the venues, you can also join. She has spoken about surgeries that they've done so far, and we are discussing thyroid itself, what thyroid is. She has given us the types, the hypo, the hyper. Are there symptoms that we have to look out for?
Yes. So when we take the hypo, so the hypo, there are some physical symptoms. So the physical symptoms, one of it, the most obvious one is when you've not increased your food, but you are putting on.
You will not increase
your food.
Everybody will say stress. Stress makes you fat.
Please, stress makes you fat. But some of them you can realize that no, this one is not really stress. You realize you are putting on day in and day out. Please, you need to go and have to check if your thyroid gland is producing enough of the hormone. Another one is on the same hypo is people, their face can be swollen. You see that under their eyes, every day they wake up and their eyes are swollen, below their eyeballs are swollen, they have chappy face. You are not really
somebody will say kidney.
Somebody, yes, it could. That's why I said I can present itself with the similar symptoms as other conditions. Some people too, they will start having joint pains. All their joints, we call it inflammations. So you'll be having joint pains, and it doesn't get better. So if you're having joint pains and it's not getting better, please don't just be taking paracetamol, taking pain relievers.
We go to the pharmacy and buy.
No,
over-the-counter drugs.
If you take it for maximum 3 days and you're not seeing improvements, we do a lot of self-medication. It's not too good. Everything has a side effect. Even if you I know that even if you drink a lot of water, you will be retaining water. Some people, their foot will be swollen and all that. As I mentioned, the swelling of the foot is also one of the symptoms. Some people too, their foot gets swollen. Others too, their joints can become very painful. The finger joints, it can also become puffy and swollen. All those things are some of the symptoms.
This is presenting like having we discussed rheumatoid arthritis.
Exactly. It's just like that. You may have all the symptoms like that. So sometimes that's why I said that you can easily be misdiagnosed. So they can treat you for that, and actually it might not be the underlying cause. When they treat you for that and it gets better and it comes again, please, when the next visit to the hospital, tell the doctor that you heard that a thyroid can present itself like that. So they should let you check if your thyroid gland is working effectively. When you take off the hyper, the one I had, you lose a lot of weight. I lost weight. I lost about 25 kg.
Wow.
Yes. I lost about
within
a period of 5 months. And I was not on a weight management program. I had just had a baby, so how would I want to
thinking of slimming?
No, I mean I wanted enough breast milk for my baby.
You were breastfeeding.
I was breastfeeding, but there was no milk in the breast, so my baby actually, God told him, so he decided to just wean himself of the breast milk, because he would be just sucking that milk and he'd get tired and he would cry. So we just started formula. So it was like that. Then the other symptoms of the hyper is that one to your menstrual cycle can also be, it can either stop or it can become too much. You may be hungry, you will eat within the shortest possible time. You are eating more, but you are losing weight. So you eat so much, you lose weight. Other people too get a diarrhea. So you eat, as soon as food enters your belly, you feel like exactly. So if that is happening to you, please, it's not normal. So you may decide to go and buy all the diarrhea stopping drug, but with time it will present itself again. Other two is the loss of hair. I lost all my hair, so I had to cut my hair. And then people also get brittle nails. You know, they used to say that those who work in the mines, those who do the galamsey, their nails sometimes affect their nails, but you are not doing galamsey. your nails is
You are
affected, it can
working in the
become
office,
very
you are
big.
walking around normal.
It can become very painful and very brittle, like soft. It will just be breaking off and all that. You need to check if you have your thyroid gland is working effectively.
Are there risk factors that people take apart from the genetic ones that you know?
Yeah, there are risk factors. People who work in radiated areas are at risk because research has made us known that if you are working in a radiated area and a lot of radiation is going to your thyroid gland, you need to you can get a thyroid disorder. Because you see, mostly those people who work on X-ray machine and CT scan, you see they have this radiation measurement button that they hang. From time to time, they check to see how much radiation has gone into me. That's what all they do. Please check your thyroid gland to see is it being affected. Elsewhere, when you are going to have any radiation procedure, they give you a thyroid shield to cover your thyroid gland, so that but here in Ghana we don't do it.
We don't.
And most of the machines come with it, but it looks like we don't even use it for that purpose.
Do we even know
that? Exactly. We may not even be aware that if the radiation enters my thyroid, I could have a thyroid disorder. And a lot of people who works in an airplane, we know the airplane uses a lot of radiation for its movement.
So
if you fly a lot, yes, you are also,
then clients, passengers,
you are also at risk of getting a thyroid disorder.
Interesting. I wanted to find out if you said it was after delivery.
Yes.
So I've had questions like, women, we have, because of our hormones, after delivery, then a lot of things
can happen. Yes. So we have we've had labor-induced thyroid disease. That some of them after delivery, the thyroid gland comes, the thyroid disorder shows up. But when they are given medication, if it's not something like genetic or it just becomes normal and they are okay. But some of us that is genetic, it doesn't become normal. You be put on medication. When it gets within the normal range and they take you off, it will start going high again. So we have some that are labor induced. Some people, their thyroid gland, even the sizes can become big during labor. We have labor induced thyroid diseases, but mostly when they are managed, when they are put on medication, it becomes okay. And then we also have and one thing too is thyroid disease affects more women than men.
Because that's why I brought up the question.
It affects more women than men.
I was fine before I got pregnant, and then after delivery, now I have so many. Some I have autoimmune condition. I have this.
So that the thing is, how women, God made us. We are very special creatures. You see, we were made out of a human being. That makes us special. That alone makes us special. So if you have any condition and human being comes out of us, we are more special, right? If you have any condition after having a human being, please, let's not attribute it, blame the baby. The second thing, let's not attribute it to spiritual thing, whatever, please. Women are made up of so many hormones. We have hormones that let us have our breasts protruding. We have hormones that make us women. That is when you start menstruating. And all the pubical area, the pubertal time period, it's when somebody becomes a woman, right? And that is when our hormones works. It's working and all that. And when we are pregnant, our hormones rise up to also work so that our babies will be safe. So during days that the hormones are high up, that is when some of these things can come up. When they come up and you need to attend to yourself, please just go to the hospital. They will screen you for all these things. These days, because of the awareness we've been doing since 2018, it's becoming something that health professionals, our mind goes on it. So when somebody is presenting with all these, especially after delivery, most of them start with the inflammations. They will have joint pains, abdominal pains severely and all that. Mine started like that. But because that time there was not much awareness, it was difficult exactly. But now
I'm having pain and then all that.
Exactly. Now there are a lot of awareness. So when I've met a lot of patients that they were like, oh, my daughter said that this, and I went to test, and then they saw that my thyroid hormones were high. So I've been put on medication and all that, and they told me that I should look for you. So some doctors are even referring patients that, okay, go to thyroid and they can help you. They will guide you through, especially with the diet support and all the things that you need to do. Even when you are diagnosed and you don't even take your medication well, you will still not be well as you should. So mostly, some of the doctors who we've worked with mostly will tell patients, go and see the Thyroid Ghana Foundation people. They have a lot of information that they can guide you through and all that, and they come. And so far, it's been helpful because we have Frank, for instance, going into thyroid diet and all that, and he's able to help. He's read a lot of research done elsewhere, and he's helping a lot of the patients with all these things. So
big ups to Frank.
It's been great. It's been very great. So if you have a baby and you present with all these things, please just go to the hospital and have yourself checked.
So she's speaking directly to mothers now.
Go to the hospital.
So you've just delivered, you are having pain, you are doing that, and then you feel you are
not feeling
losing weight.
Exactly.
More often than
you are having severe headaches and all that. You realize that you've never been happy.
It's not pregnancy flash or labor flash.
No.
People will say, oh, heat.
Baby.
And your heat.
You realize that you are having inflammations. You realize that you are having headaches. You realize you are losing your hair. You realize your BP keeps going high and all that. Please have your thyroid gland checked. Probably it's overproducing. Maybe you've had the labor-induced type. Once you are well diagnosed, you'll be fine.
Yeah.
But if you are not well diagnosed and they treat the symptoms for you, it will come back again. So you'll be trooping in and out of the hospital like that.
Okay. So let me open my phone lines, then we'll continue. 050-815-6857. 050-815-6857. Call in. Send your messages through 0204-391417. 0204-391417. Please don't call the WhatsApp line. Please don't call the WhatsApp line. Call 050-815-6857. So all the numbers are on your screen, but please, when you call in, lower the volume of your TV set or move away from your TV set so that we can hear you and then we wouldn't get feedback. I would want to pick your experience a bit, but before that, how are you diagnosed? Is it through a lab test or is it through scan? Or
okay, so some people are diagnosed by the physical look, like especially the goiters. As soon as it's showing that one, I say that they are the lucky ones.
Yes,
because that one is showing, so anyone can pick it up. But those of us that ours was not showing, you were sick, you have been sick for some time and all that, just go to the, you can, if you maybe you don't even have.
How long before you were diagnosed?
Almost 8 months. Almost 8 months.
Hello. All right, sorry. Hello.
Hello.
Hello. Good evening. What's your name and where are you calling from?
I'm calling from Ethiopia.
Hello.
Efia.
Efia.
Yes, please.
Yes, Efia, go ahead.
You can speak to you.
Yes, you can, my dear.
Mr. Cho, me true. Anytime dear, baby, moments dear, me true. I better me yet. Into me go hospital. Me go hospital and me catch your doctor. Doctor me say, me say, me thyroid na area me sa. Into wama me do dear.
Wama we do bia. Wan ka hwe so anche
Baby.
Okay.
Wama anye test bia.
You can.
Okay. Wama anye test bia so. You
okay.
and see what thing inside?
No, Cambodia.
Koforidia ha. Wait me ako you Koforidia government hospital and I baby call hospital no. Sister wait me as doctor na ko baby for. No aka cha omo say.
Okay.
Would say thyroid gland for yes say utanya throat pain in your throat. I wait me akoye tester ebe chere say wo thyroid ni okay and I say enyo okay why? Until we are waiting me to share Thyroid Ghana or Facebook and I say website Thyroid Ghana Foundation and number near BBL
or the number no so better why
now I was a pay report now my why
okay
not my
hello hello okay you made us say I mean pick you before hello all right so we lost that person Ban is saying that.
So some people too. So one of the things that they may have is they may be having on and off pains in the throat. It can become on and it can also go off. Or some people will be having what we call sore throat. If you're someone who gets sore throat too often, please you should have your thyroid gland also checked. It's also one of the symptoms.
Okay.
If it's not your tonsils that is inflamed, you know we have tonsils. And the tonsils you can even see it. But the thyroid gland is a bit lower. So if you get that pain, sore throat often, and you treat it, still doesn't get better or it comes back, please, you should have your thyroid gland checked. It's also one of the symptoms.
Okay. So we're talking about diagnosing before the call came in.
Yes. So as I was saying, those who have the scan, the protruding, the goiter, yes.
Okay. So sorry. Hello. Hello. Hello.
Hello.
Hello. Good evening. What's your name and where are you calling from? Oh, please move away from your TV set or lower the volume. Hello. Okay, so I lost that. All right.
Yeah. So the other thing is those that it doesn't show. You can just, if you realize all the symptoms that I mentioned, if you've seen it in you. You are losing weight or you are gaining too much weight, please you can go to any accredited laboratory facility, any accredited, and then go and tell them that you want to do thyroid function test. When you do the test and it's ready, you get the report, you can send it to us, we'll look at it and then we'll advise you on what to do. Or when you get the test and maybe you have a hospital that you go to, you can just take it to the doctor and tell the doctor to interpret it to you. And then they will let you know what it's in the report. Mostly they will take a small blood and then they will use it to test.
Is it everyone that goes through surgery? Hello. So sorry. Hello. Hello. Good evening. What's your name and where are you calling from?
My name is Kenneth.
All right.
I'm calling from Adwoa.
All right, Kenneth, go ahead.
My problem is after my wife gave me some years ago, but she always complains of wastage, and I wanted to find out what are the possible causes.
Okay, because you mentioned pain after birth.
Pain after birth.
Okay, all right.
What did she say?
You said the wife has given birth. Yes. Hello.
Hello.
Yes, Kenneth, I can hear you.
I think my wife gave birth 6 years ago.
6 years
She always complains
of waist pain. All right. All right. All right. All right. All right. All right. You're welcome.
Okay.
So because you mentioned pain after, and he said it's been 6 years now, she's still complaining of pain.
Okay, she should let her go to the hospital, and then this what I mentioned was abdominal pain. So waist pain and abdominal pain, they're two different things. They can do an X-ray for her to see is there anything if it's.
I didn't even ask if it's CS or it's normal pain.
If it's an abdominal pain, then they will scan your abdomen to see. If they scan and everything is normal and still the pain is there, that's what mine was. Everything was normal, but the pain was there. So with time, when they saw the thyroid gland was what it was.
Hello.
Hello.
Hello, good evening.
Good evening. Your name and where you're calling from?
Yes, I'm calling from Ashona.
Okay. Your name?
Esther.
Esther. Esther, go ahead. Please lower the volume of your TV set or move away.
Esther.
Yes, Esther, move away from your TV set. Oh. When you call in, please lower the volume of your TV set. Lower the volume of it. My producer just said something. I'm not going to say it. Just lower the volume of your TV set or move away from the TV set so that we can hear you, please.
Yeah, so after when they do the scan and everything is normal, then you can tell the doctor, please, I heard about the thyroid disease. Can you scan? Because one, it could be a thyroid problem and you're having the inflammation. So later, after I was diagnosed, that was when I was, and after attending a lot of conferences about these things, that was when I was able to know that, oh, apparently it was the inflammation that I was having at my abdomen. So if it's not anything related to your abdominal, the area, they will do the scan, everything will show normal, but the pain will be there.
It will be there.
So that was so if it's not abdominal pain and it's a waist pain, I think it's totally different thing. They could just go and see a doctor to let them do a waist X-ray or something for proper diagnosis.
Hello. I don't know what's wrong with my lines today. Hello. Oh, sorry.
Yeah. So they should do that.
Hello. Yes.
Yeah. Because I'm having a problem with my abdomen any time of my menstruation.
It's any time you menstruate.
Yes.
After menstruation, the pain is not there.
Yeah, it's not there.
Oh,
it's
then
not
that
there.
one is.
Then that one is normal menstrual
cramps.
Okay.
If it's getting worse, you can take a paracetamol and then it will be okay. Some of us have had it, but it's different from the thyroid disease.
Okay. Thank you.
Okay, so I think people are getting a bit confused about it.
So this, what I mentioned it's not a menstrual pain. Not that you are about to menstruate and you are having the menstrual. That one is menstrual cramp. Some people have it. Some people can. When this is quite severe.
Yeah,
but as soon as the menses pass, they are okay. But this one is, you are not in your menses, or you are not about to have your menses, but you are having inflammation, abdominal inflammations. This one is not for the menses. Abdominal, it cuts across. So that is what we are talking about. I think people should know
the difference between their abdomen, their tummy,
the waist, and all that.
Because we are usually this pain, people confuse them. So whether it's your abdomen,
talking about the waist pain, no, waist pain and abdominal pain is not related.
It's not related. I asked if
everybody needs a surgery. No, it's not everyone that needs a surgery. So there I would say there are 4 types of treatment options. If you have a cancer, they also have their treatment line. Some will do chemo, some will do radiation and all that. If you have any of what I mentioned, if it's a goiter, you have to remove it. That one you need a surgery. That is if it's showing, if it's becoming enlarged. If it's like what I had, a Graves' disease or any of the hyper and it's not showing, you have the option of maybe you'll be put on medication to manage the production of it, or they will do the surgery, or they will ask you to do radioactive iodine. Radioactive iodine treatment is a radiation turned into tablet. What it does is when it is administered on the person who needs it, it's supposed to go in there to stop the activity of the thyroid gland. So it goes to kill the thyroid gland from overproducing. Okay. So that you can, if it kills it and you get whatever is coming out is okay for your body, fine. If it makes it go below the production of it, which doctors prefer, that one, then they will give you it's being hypo. If it's hypo, management of hypo is okay, because the side effect of the medication that is given to somebody who has a hypo is almost negligible. That's what research have made us know. Unlike if it's overproducing, like what I had, the side effect of the drugs that are given to you is quite serious. So mostly doctors will prefer it being hypo. I could have done the radioactive iodine if I had not had a baby who was under 5 years.
Oh.
So there are rules.
Okay.
Some people too may not qualify to do a surgery, like maybe somebody who has a pacemaker in their heart and all those things. Doctors, no surgeon will touch you with a knife, right? So there are other medical conditions of an individual that will let a person qualify for a particular type
So you can just
of treatment option.
So it's not just you
You
having
opting
thyroid,
for it,
yes,
yes.
and opting for no. You might have thyroid, you have hypertension, you have this. Then they decide.
Then they decide that no, surgery is a no-go area for you. The other option you may have is maybe you take the medication to manage you, or you take they will do the radioactive iodine. They will administer it for you. The only problem is it's very expensive. The radioactive iodine treatment is very expensive because the medication is not from Ghana. They import it from Europe, and the patient that they are importing it for you pay the import duty, you pay everything, you bear it. So if at a particular, mostly the places that they administer, the doctors try to see if they can get a group of patients so that they will spread the cost for you, so that can come down a bit. Exactly. Either than that, one person, if you like, it's emergency, they will import it for you and you pay everything. So mostly if they get like 3 to 5 people, then that one, the maximum you pay will be about 12,000. Yeah, between 8,000 and 12,000 cedis. That is if you're about 3 to 5 people. Either than that, you can pay as much as 15 to 25,000.
Can the government do something about this, bringing it down?
So currently, what we are trying to do is we are trying to work with the Konadu cancer nuclear medicine. We're working with them to try and write a letter to government to take off. You know, some drugs comes and it's non-taxable, to try and take it off. So now that is one of the projects for this awareness. From now till next year, we are hoping that we'll be able to achieve that. You know, it goes through a whole lot of processes, and so that is one of the things we are trying to see for this year as well.
Okay, I would like you to take the awareness week again, because we've done thyroid. I know definitely I'll bring you again for you to take us through the diet and all that, and then the myth of people taking too much salt. That's why they have the goiter. But our time is running out, so maybe you should take us through the awareness week again,
so
the programs, and then your contact lines and where we can find Thyroid Ghana Foundation.
Okay, so you can find Thyroid Ghana. I'll start with that one. You can find Thyroid Ghana Foundation on our website. We have a website, www.thyroidghanafoundation.org. www.thyroidghanafoundation.org. When you go there, you find our numbers, you find everything about us. The second thing too is you can find us on Facebook, you can find us on Instagram, you can find us on even TikTok. Thyroid Ghana Foundation, just type it and it will pop up, and YouTube as well. When you go to YouTube, you've been diagnosed to do a thyroid surgery and you are afraid, go to YouTube. All the surgeries we've done from last year, we've put the videos there. The people we've done the surgery for are talking about it, so that you can be encouraged to go and do it. So on the awareness, on the 25th, we are launching this year, that's phase 2 of our surgery project with University of Ghana Medical Center. It will be chaired by the CEO of UGMC, Dr. Darius. He will chair that with the program, and then our special guest is the provost, the former provost of College of Health Sciences, who is the board chair of Thyroid Ghana Foundation, Reverend Professor Ikumi. And we are going to have 2 presentations, one on the importance of having a congenital screening for our babies for hypothyroidism. The second one is the facts and myths of thyroid surgery. Yeah, the facts and myths is the important. So we are going to have this at UGMC, University of Ghana Medical Center. It's located at Legon after Noguchi. Yeah, that's a new hospital in town. It's like Abroche. Please come and have a look at the place. Go and feel the place. Come and feel the place. So that's on Wednesday 25th. Then on Saturday at Konadu, we are going to have our food bazaar and dietary support after you've had your thyroid surgery. So if you are someone who have had a thyroid surgery, or if you are planning to have a thyroid surgery, please come. There will be food demonstration as well for you to know the kind of food that you need to eat. Then on Monday, we are going to have another webinar.
Where would you do that?
Konadu at the MSSI. It's around. It's before the Red Building, their conference room. That's where we are going to have that one. Then on Monday at UGMC again, we are going to have a media engagement on. We are going to have a lot of thyroid patients sharing their stories.
Okay.
So if you're a thyroid patient that you want to come and share your story to encourage people, to encourage those who don't know what to do, please, you can come on board. We are having it at the University of Ghana Medical Center next week Monday at 9 next 2 weeks Monday at 9 a.m. Then on the Tuesday, that's the 31st,
that's the final
day, we are going to have the ENT surgeon at Konadu. That one too, we do it at the MSSI conference room close to the Red Building. We are going to have him tell us about the ENT, the role they play in thyroid care, so that we will understand why you'll be referred to go and see a ENT surgeon when you have a thyroid condition. Then on Sunday, we are making a donation to a children's home called Chosen Children's Home at Dakuman in Accra here. Okay,
can we get a contact?
So to contact the Thyroid
so that
Foundation,
they can make their donations to.
Please call 0243 376304. 0243 376304. When you send a message, please, if you want to call within working hours, from Monday to Friday from 8:30 to 6 p.m. Monday to Friday, 8:30 to 6 p.m. If it's an emergency and you want our advice on something, please send a WhatsApp to the same number and we would respond to you. But if you want to call to discuss anything, please call within the working hours. Not some people will want to call you as late as 12 a.m. 10 p.m. Please, no. We work within the normal working hours. So if you want to support us too, you can let us know wherever you are. We are asking for drugs to support the surgery. So if you're a pharmaceutical company, you want to come on board, please call me. I'll come to your facility and collect what you want to support the people who need the surgery with.
All right.
Thank you very much.
You are welcome. Thank you too for coming.
Okay.
Thank you for watching. My outfit is from Pauline Smith Fashions. You can get Pauline Smith on 055-941-8555. She's located at Dansoman. My skin is cared by Garnic Organics. Garnic, you can contact Garnic on 0241-466-935. 0241-466-935. She's located at Teshi Greda Estate. You can get my hair products and then my stylist hair funny on 0543-560000. 0543-560000. We are refreshed by Propine Fruity. Contact them on 0540-448500. 0540-448500. Get free juice for your kids for school. Thank you so much for watching. If you want to sponsor the program, call 0204 391417. 0204 391417. That's Garnic's contact out there on the screen, so you can contact Garnic and then see her for your skin or skin problems. Thank you so much for watching. It's same time next week. I'm Adwoa.